Gentlemen, I am Dr. Thomas, and today we need to have a very honest, very private medical conversation. If you are an older adult and you masturbate, I need to ask you something that you have probably only ever asked yourself in silence. Have you ever wondered if it is still healthy for your body after the age of 50, 60, or 70? Or have you worried quietly, am I damaging my hormones? Could I be ruining my prostate? Is this somehow weakening me as a man? If you have ever had those thoughts, I want you to know right now, you are not alone. This is one of the most common yet least talked about concerns I hear in my clinic. For decades, older men have been left completely in the dark, surrounded by locker room myths, outdated cultural guilt, and a total lack of clear medical information. You have been told that self-pleasure drains your energy and ruins your health. But what does modern clinical science actually say when you strip away the shame and the noise? The biological truth paints a very reassuring and surprisingly empowering picture. Self-pleasure is not a guilty habit reserved only for your youth. In fact, modern medicine shows it can be one of the most protective and therapeutic practices for your aging body. But like any medical tool, it depends entirely on how you use it done recklessly. It carries real physical risks. Today, I am going to walk you through both sides of the clinical coin. I will reveal the 10 surprising medical benefits science has uncovered and the 10 hidden risks you absolutely must watch out for to keep this practice healthy. Quick pause before we dive into the biology. Tell me in the comments, where are you watching from today? I love seeing how far our men's health community reaches. And while you are there, hit that subscribe button. That small action helps us keep bringing you these honest, stigma-free conversations. Let's get into the science. Here are the 10 benefits that will completely change how you view your body. Benefit. Number 1, it maintains penile health. Think of masturbation as a form of highly targeted physical therapy. Biologically speaking, every single erection pumps fresh, highly oxygenated blood into the spongy tissue of the penis called the corpora cavernosa. As we age, that blood flow is absolutely essential for keeping those tissues elastic and preventing fibrosis, which is the hardening of the tissue that shrinks your size and strength. Practically, it means the more you keep the biological machinery in motion, the more reliable it stays. Benefit. Number 2, it protects your prostate. This one is massive. Researchers at Harvard University conducted a landmark study and found that men who ejaculated frequently, specifically around 21 times a month, had a staggering 33% lower risk of developing prostate cancer. Why? Because ejaculation physically flushes out old fluid, stagnant toxins, and inflammatory substances from the prostate ducts. Emotionally, this knowledge should replace your fear with empowerment. You are not damaging your prostate. You are actively protecting it. Benefit number 3, it strengthens the pelvic floor. Those involuntary muscle contractions you experience during orgasm, they are aggressively exercising your puboxygeus PC and surrounding pelvic muscles. Biologically, a stronger pelvic floor means much better erectile rigidity, more ejaculatory control, and a vastly reduced risk of urinary incontinence later in life. It is literally a free internal workout. Benefit number 4, it lowers stress hormones. Orgasms cause a massive immediate drop in your body's primary stress hormone, cortisol. Lower cortisol instantly translates to lower blood pressure, better cardiovascular health, and a profound reduction in physical anxiety. Benefit number 5, it boosts mood chemicals. When you climax, your brain floods your system with dopamine and oxytocin, the ultimate feel-good and bonding chemicals for older men dealing with isolation or the physical aches of aging. This acts as a natural, biological antidepressant, lifting your mood and giving you more patience and positivity for the rest of your day. Benefit number 6, it improves body awareness by regularly touching yourself. You become deeply familiar with your own normal anatomy, That means you are far more likely to notice sudden changes, like painless lumps or unusual curvature that could signal early-stage testicular issues or Peyronie's disease. I have seen men catch these conditions early simply because they knew their own bodies well. Benefit number 7, it cures insomnia after orgasm. Oxytocin rises, a sleepy hormone called prolactin surges, and cortisol falls. In chronobiology, that is the exact perfect chemical recipe for restorative deep delta sleep for older men who suffer from chronic insomnia. This is one of the most powerful natural sleep aids available on Earth. Benefit number 8, it improves pelvic circulation beyond just the erection. Masturbation vigorously boosts blood flow through your entire lower pelvic region. That means a healthier bladder, less tissue stagnation, and a reduction in chronic pelvic pain. Benefit number 9, it trains ejaculatory control if you have ever struggled with finishing too quickly. Solo practice is the safest clinical environment to practice the stop-start method. Biologically, this builds stronger neural pathways to recognize your own arousal levels, translating to immense confidence when you are with a partner. Benefit number 10, it keeps neural desire alive. The brain is, without a doubt, your biggest sex organ. Regular self-stimulation keeps the specific neural circuits of arousal actively firing. It prevents what we call sexual shutdown over time, even if you don't currently have a partner. It ensures that your brain and body are ready when intimacy does come your way. Those are the 10 benefits. Incredible, right? But as a doctor, I must remind you that health is entirely about balance done recklessly. Masturbation carries real clinical dangers. Let's flip the coin. Here are the 10 risks you need to watch for. Risk number 1, social isolation. If self-pleasure becomes a total replacement for real human intimacy, it can slowly push you into emotional isolation. The clinical fix is simple. Be mindful. Use it to complement your life, never to replace human connection. Risk number 2, skin microtears. This is a major physical risk for older men. As we age, our skin naturally becomes much thinner and loses collagen. Too much friction without proper lubrication causes microscopic tears, severe inflammation, and even bacterial infections. The fix: always use a high-quality water-based personal lubricant. Treat your skin with medical care. Risk number 3, neurological desensitization. If you use the exact same routine, the exact same grip, and the exact same pressure, every single time your brain chemically adapts, suddenly only that specific touch works, and you feel nothing with a real partner encouraging the fix. Mix it up, change your technique, alter the rhythm, and keep your brain's neural pathways guessing. Risk number 4, masking erectile dysfunction. If you can easily perform solo, but you constantly lose your erection with a partner, that is a massive clinical red flag. Often men blame it on age, but sometimes this signals underlying diabetes, severe vascular disease, or crushing testosterone. Do not ignore it. See your doctor. Risk number 5, pudendal nerve compression per posture, like hunching over on the edge of a hard chair for extended periods, can severely pinch the pudendal nerve in your pelvis over time. This causes terrifying numbness and chronic pelvic pain. The fix: lie down, relax, and properly support your spine and pelvis. Risk number 6, emotional escapism. If masturbation becomes your only coping mechanism for financial stress, grief, or loneliness, it creates a psychological dependency. The fix: pair it with other healthy dopamine sources like exercise, social interaction, and meditation. Risk number 7, the weight of guilt. Many men grew up with harsh cultural messages that painted their bodies as dirty. If that guilt still physically weighs on your chest, it spikes your cortisol and ruins the benefits. Your body is not your enemy. Risk number 8, pelvic congestion. Yes, Infrequent ejaculation is bad for the prostate, but so is extreme excess. Doing it multiple times a day for long periods can cause a condition called pelvic congestion, leading to a heavy aching prostate and painful urination. Moderation is key risk number 9. Biological depletion. While less common for seniors trying to conceive, ejaculating every single day does reduce sperm concentration and seminal volume. If you feel physically exhausted the next day, your body is telling you to take a 48-hour break to replenish its zinc and protein stores. Risk number 10, disconnection from reality. If your brain's only sexual stimulation comes from extreme high-speed internet pornography, your dopamine receptors will burn out. You will struggle to feel aroused by the subtle beauty of real life, intimacy, the fix limit, the screen time. Use your imagination. Focus on the physical sensation of touch and protect your brain chemistry, gentlemen. You now have the complete clinical picture. Think of masturbation as a medical tool. Like any tool, it can beautifully build and maintain your body, or it can harm it, depending entirely on how you use it. Here is your action plan. Keep it regular, but moderate. Always protect your aging skin with lubricant. Stay aware of your posture. Mix up your routine so you don't desensitize your nerves. And most importantly, never let it replace the warmth of true human connection. I know this is a deeply personal subject. Many of you have carried quiet shame around this since you were teenagers. But as a doctor, let me reassure you, there is absolutely nothing shameful about keeping your body healthy. Science is on your side. Your prostate, your heart, and your brain all benefit when you approach this consciously. Age does not mean the end of your vitality. It is simply the stage of life where you finally let go of the myths and embrace the biology that serves you. I want you to make a pledge to yourself today. Go to the comments below and type, "I am honoring my body today." If this masterclass lifted a weight off your shoulders and gave you the reassurance you needed, please hit the like button and share this video with a friend or brother who needs to hear the truth. I am Dr. Thomas. Your worth is not defined by outdated myths. It is defined by how well you care for yourself. Stay strong, stay confident, and I will see you in the next video.